Right now, COVID-19, 1 year later, heartache, heroes, and hope. All this week, 12 News is taking a look back at this very tough year and how it has impacted our lives. And as the virus mutates, it's clear we still have a lot to learn about how this new virus works.
But doctors are making progress when it comes to treating patients. I spoke with Dr. Mitchell Levy from Lifespan about how treatment has evolved and how it may help us manage other diseases.
How did doctors approach this when the virus first arrived here in Rhode Island? Was there any sense of how to treat this?
Yeah, it's obviously a great question, Kim. And looking back on it, the first case certainly here in Rhode Island was in the late February at the Merriam Hospital. It's remarkable when you think about the fact that the disease itself is a little bit more than a year old. So that's just so astonishing when you also consider that there have been so many millions of cases worldwide, and I think at least 25 million in the United States alone. So, and so many deaths as well. And yet in the beginning phases, so the beginning phases, I would honestly say is the first 6 months until the release of discovery results, which was with dexamethasone in July. So that's 7 or 8 months. In the beginning, we were just learning about this terrible illness and really were feeling our way as if it was the blind leading the blind, to be honest. We knew that this is a devastating disease. We knew that it causes a lot of we know that it causes a lot of clotting in the lungs and the blood in general, and we know that it causes lung injury. So in the beginning, we were using mainly supportive care. As we know, the mortality rate overall from COVID-19 is quite low. It's less than 5%, but about 20% will develop a need for hospitalization. And of that, about 25% of the people who are hospitalized wind up needing critical care. So they're not small numbers. But overall, the message has always been, this is not a fatal disease. But when it occurs, especially in patients with diabetes, high blood pressure, and the elderly, the effects can be devastating.
Can you sort of walk us through what is available to patients who develop a severe form of COVID right now?
Yes, of course. So first came the dexamethasone, the steroids, as I said, and then probably the next big introduction was the use of a series of monoclonal antibodies, not for people who were in the hospital, but interestingly enough, for patients before they became hospitalized. So outpatients for infusion of these monoclonal antibodies. These are monoclonal antibodies that fight the virus that's in the blood in patients before they get sick, and have been shown, the combination of these antibodies, to reduce the likelihood of progression to needing hospitalization. So those monoclonal antibodies are produced by several companies. In fact, those monoclonal antibodies are the same antibodies that former President Trump received when he went into the hospital, and they're now much more widely available. They're about to receive an emergency use authorization from the FDA, the Federal Drug Administration, for use in outpatients prior to hospitalization. So that's a very, very important advance.
Do these advances give you hope that we can apply this type of research, this type of speed, this type of accuracy, as you're mentioning with the efficacy of the vaccine, to other treatments for other diseases?
Yeah, I'm smiling because a lot of my work is in sepsis. And so COVID-19, when you develop organ dysfunction, whether it's respiratory failure or renal failure, or even some of the effects it has on the brain or shock, these are all commonly associated with COVID-19. That is sepsis. It's just a viral sepsis. And that's no different than the things we see with bacteria, or that we see with other viruses, or with the flu for that matter. And so it does give me hope that if we take the lessons learned from our response to COVID-19, they may well apply to other diseases that we've been very frustrated by in the past.
And that was Dr. Mitchell Levy, Lifespan's System-Wide Director of Critical Care. You can watch my full conversation with him tonight on WPRI.com. Plus, you can explore an interactive timeline documenting the start of the pandemic right up until the present day.